A small red mark after Ozempic, semaglutide, or Zepbound, tirzepatide, is often normal. A shot site reaction becomes a problem once it keeps growing, gets hotter, or hardens. It can also become a problem when it keeps returning in the same pattern. The goal is not perfect skin after every injection. The goal is knowing when a simple irritation stops acting simple. Most people make one of two mistakes early. They panic over a tiny pink patch that was always going to fade, or they keep dismissing a reaction that is clearly getting worse because they assume every injection mark must be harmless. The pattern matters more than the first look. Technique can confuse the picture before the drug itself does. Using almost the same spot again and again can keep the area sore. Injecting into skin that is already irritated can do the same. Rushing the shot into tense tissue can also make a routine injection feel worse. That can happen even when the medication is not causing a dangerous skin problem. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These drugs go under the skin, not into muscle or a vein. The approved areas are the abdomen, thigh, and upper arm. Rotation matters because skin that keeps taking repeated hits in the same area can stay irritated. Over time, that can lead to repeated soreness, small lumps, or thickened tissue. When that happens, repeat site irritation can start looking like a drug problem. Many people assume the medication is causing a new skin reaction each week. Sometimes the real issue is that they are quietly reusing the same small zone. Switching sides on the abdomen may still be too close if the same patch never gets a real break. That confusion is why the reaction can recur, the area can stay tender, and the patient can start blaming the pen. That mistake is common when people think they are rotating enough. The real consequence is that a fixable technique problem starts looking like a medication problem. In many cases, the real problem is technique, not the drug itself. A normal local reaction usually stays small and local. That can mean mild redness, brief itching, tenderness, a bruise, or a short burning feeling where the needle entered. If it starts improving over a day or two, that usually fits simple irritation rather than a bigger medical problem. Many people never need anything more than observation and better site rotation. Appearance alone can mislead you. A bruise can look dramatic and still settle on its own. A firm patch that keeps enlarging can matter more than a bruise that is already fading. Warmth and pain that keep increasing also matter more than color alone. Different causes can start out looking similar. One group of reactions comes from the needle, cold medication, or sensitive skin. The other group can point to more than routine irritation. That can include infection, allergy, or repeat injury to skin that never fully recovered. The early look may overlap, but the pattern over time usually separates them. Some reactions still deserve more caution, especially in higher risk skin or patients. Fragile skin, eczema, chronic steroid use, easy bruising, and blood thinners can all make the site look worse. Prior swelling reactions matter too. In those settings, a reaction that seems borderline on paper may deserve an earlier call. The official Zepbound drug label also supports taking repeated reactions seriously. Injection site reactions were reported more often in people who developed antibodies to tirzepatide and less often in people who did not. Those antibodies are immune proteins the body can make after it reacts to a drug. That does not mean every red spot is an immune problem. It means repeated or unusual reactions deserve more respect, especially when the pattern changes over time. Warning signs help separate a minor reaction from one that needs medical attention. Spreading redness and increasing swelling should not be brushed off. The same is true for worsening pain, warmth, drainage, pus, fever, or a hard area that keeps expanding. The same is true for hives, face swelling, lip swelling, tongue swelling, throat symptoms, trouble swallowing, or trouble breathing. Timing helps too, and redness moving outward beyond the needle mark deserves more caution. A little sting right after the shot can be routine. A reaction that is worse tomorrow instead of better deserves more respect. A lump that lasts for weeks also needs review. So does a reaction that shows up after every injection despite real rotation. Location and spread help too. A normal irritated spot usually stays close to where the needle entered. A broader reaction often acts larger than the injection itself. Redness moving outward, firmness beyond the original area, or swelling that keeps widening all deserve more caution. The key question is whether the area stays contained and settles down, or keeps spreading and worsening. If the area is spreading or clearly worsening, stop using that exact spot for the next dose. Pick a different approved area and let the skin recover. Do not rub, scratch, or keep pressing on the site to check it every hour. That can make irritation look worse and confuse the picture. Take a photo and note the date, the body area, and whether the patch became bigger, hotter, firmer, or more painful. One mild mark alone is usually not enough reason to assume you must quit the medication forever, but do not keep injecting through a clearly worsening reaction without guidance. Mild irritation usually calls for observation and better technique. Escalating reactions call for a real clinical decision, not guesswork at home. Once the worsening reaction is being addressed and has started settling, rotate by precise location, not just by body region. Sometimes the next dose needs a different body region, not just a nearby spot. Abdomen this week does not mean the same inch of abdomen every week. Give irritated skin time to recover fully before using nearby tissue again. If the same lump keeps returning in one zone, stop using that zone. If a thick patch is forming, stop using that zone too. Repeated use of the same zone matters because skin changes can build slowly when the same area keeps taking hits. Once tissue texture changes, the site is asking for a break, not another injection there. Avoid abnormal skin from the start. Do not inject into areas that are red, scaly, damaged, lumpy, bruised, or already sore. If your pen uses separate needles, follow the instructions and use a new one when directed. A dull or reused needle can make the shot more traumatic and make the skin response harder to read. Let alcohol on the skin dry before injecting. Let refrigerated medication warm as directed before use. Do not press too hard afterward unless you are controlling a little bleeding. If you bruise easily, gentle pressure is usually better than repeated rubbing. If the spot is getting smaller and calmer, that is usually reassuring. If it is getting bigger, hotter, harder, or more painful, treat it like a real problem. And if the same area keeps reacting over and over, do not assume the drug is the whole story. Sometimes the real issue is the site, not the shot. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.